Varsha Dodhia, who has who has got a lot of experience about the whole issue of elderly care, which is a big problem facing Britain today. And you may all know that the Indian community in Britain has this huge wisdom about joint families and care for the elderly, and there is a tremendous importance given to the connection between the elders and young people and their grandchildren, and this is kind of maintained still today, and so that there is a strong element of love in the care for the elderly. However, of course, the times are changing. This is not India. This is a modern Britain, fast-moving Western society. The houses are small, families grow, expand, they move, etc. So challenges are being posed to the community. But it's quite interesting how Varsha is actually creatively, using her tremendous skill and creativity, is finding new ways to solve this problem. So Varsha, tell us a little bit about the scale of the problem for the elderly people in this country, and the kinds of solutions which are available for Indians.
Okay, as I told you, traditionally our model is a joint family. So when a girl actually got married, she actually left her parents' house and joined the husband's family. So basically moved and adopted the new family. In Britain today, I think as the culture is changing, as people have different career aspirations, a lot of women are also working. This is quite a major issue. And for 3 generations to live under one roof has its own pressures as well. So at the moment, as I said, we were caring for both my father-in-law and my mother-in-law. My father-in-law had dementia. My mother-in-law has severe rheumatoid arthritis.
So you lived as a joint family?
Yes.
For many years?
For many years, until my husband got a job and we moved to Belgium. But of course they stayed behind and they had the family home as well. But the responsibility for caring is just not only physical care, but making sure that they are all right, So if there's anything wrong in the house or whatever, it's our duty to make sure it's all done.
So what did you do to help them to adapt and keep their independence rather than go in the care home?
Okay, the first thing is, I think it's quite familiar. A lot of Indian families would have an extension built to their house. So there's a special bedroom. In my mother-in-law's case, we had a special bedroom for her downstairs. And we adapted a shower room for her so that it has a disabled facility. So, she is quite independent. And now she needs carers, so the carers find it very, very easy to actually help her get dressed in the morning. And during the day, she has a Zimmer frame, so she can manage to be in the house, be independent in that way. So, if we didn't have these facilities, then it might be that she'll end up in a care home, which she just doesn't want to be. There's no way she would want to be in a care home.
Yeah, but what about getting carers with the kind of cultural and religious sensitivity and the dietary needs that your mother-in-law has? How do you go about finding them and actually training them?
Okay, traditionally, the model was that because she is under social care from the local council, so there would be agency carers coming in. But what the government has done in the last few years is giving people who need care a personal budget. So for the last year, my mother-in-law has had a personal budget. So in this way, she has a lot more choice and control, and so do we have a lot more choice and control. What we have is, from this budget, we have employed a carer. There's only a single person who lives on the parallel road. We've known her, so actually this person has a house key as well. And the kind of care she provides, she speaks the language, she understands what my mother-in-law would need. So, it works really well for us. And times when she has to go out, we know in advance, so we always make arrangements. We have a temple right next to us, so that is a great resource. And I think all communities have, these community resources which can be used. So from that, I think, now I'm looking at how can I really help other people achieve the kind of, benefits we've had with the personal budget. So I want to set up a community interest company to actually help people do that.
Wow, I mean it's quite interesting that even though you're living away from your mother-in-law's home, you're still taking an active interest in her care and helping her to manage it. And can you tell us a little bit more about this new concept that you have developed about how this experience can be widened and more people can be helped?
I mean, I think the company that I'm looking to form is called Ahimsa Care, and the idea is that all the carers, they need support when they're caring for somebody. Imagine somebody is going through cancer in the family, then the people in the house would need some help with caring. Somebody's fallen down and they need time, just to get them up and running. So the idea is to really offer support, and a lot of times there are forms to fill out, or even if you have funding to find the right person, and there's legislation, you need a particular CRB check, you need to keep your records. So the idea is that, especially for the elderly who find it very difficult to go through all this paperwork and the bureaucracy, you actually help them to set it up and then help them monitor it. And because somebody who knows how to do things, then it's set up correctly from the beginning, rather than having problems as you go along. So if it's set up correctly, then it will run correctly. And on the other side, the carers, caring can be very, very difficult in this country. A lot of carers experience carer burnout because they wake up in the night. They've got long days at work, they've got other family pressures, so they also need help, and there are times when they just need some respite from caring. So we can actually help them to have a little bit of time for themselves to recharge their batteries.
Wow.
So that they can carry on caring.
Wow. So what you're effectively saying is that even in this concept of Ahimsa Care and the company that you're planning to set up, you're actually bringing the kind of wisdom and compassion of India, in the provision of love and care and sensitivity, so that it's not just about money, it's not just about commerce, or it's not just about a product or a service, but it's actually also about delivering it in a sensitive way, delivering it with love and understanding, and also in a way in which the carer and the patient or the person would like to receive the care.
Yes, it's very, very important, because a lot of the facilities Britain was providing, there are going to be budget cuts, so the challenges are all there. And in a way, we as communities, we understand what the caring needs are going to be. So as a community support, we need to really make sure that the elderly are looked after. It's our concept is the elderly have always been viewed as shows of wisdom. A lot of Indian homes, you would see that the young people, when they go in, they go and bow down to the elders. Maybe not every day, but on many important occasions, we still pay our respect to the elderly. So the way elderly are really cherished, and a lot of people, from your and my background, have actually travelled from village India, maybe via another country, and then arrived in Britain. So for them, they have seen a lot of changes in their lives. So in a way, the last years of their lives are also very, very important. And in a way, if it can be done in a family-friendly and sustainable manner, then that's really, really important.
Fantastic. So just going on a little bit further about this concept, how can the concept of Ahimsa Care actually also help the whole of Britain, not just the Indian community in Britain? How can you take ideas from this to take to the care profession in Britain? What is unique about the Indian wisdom of elderly care?
The Indian part is that you make sure that the whole community is looked after. We have traditionally built community centres, we have luncheon clubs, whichever. We have even places in Harrow where elderly men go and just play cards. So they meet up, and the social element is very, very important. So I know if you have bhaktis, where ladies meet up and they do satsang as well. So all this is very important, and it's actually what our Prime Minister is saying about the bigger society. We actually live and breathe big society, that we look after various elements in our communities. So I think this wisdom about communities is very, very alive in our genes in a way. everybody would say, oh, which village do you come from? You know, there are different communities. There are communities of professionals, there are communities of like-minded people. People may go and play just bridge together. That's a community. So living the community spirit and helping each other is the way forward for us, you know, living in 21st century Britain.
And I think the other aspect, what I hear from you very clearly, is the importance of love and family. That love is as important to elderly care as a pension or as a provision. You know, that I get really upset when all the talk is about pensions and whether people are going to get the money for their pensions. But actually pensions are only one part of the story. That if there is love, if there is a family relationship, it actually goes very far in actually caring for the elderly. And we are seeing on the other side the huge mental health problem that this country is facing, and it is, a lot of it is because of the lack of love in society, and especially for the elderly.
I think it's isolation.
Yeah.
It's isolation, even when people are far. So it's like the house here is open house. A lot of the grandchildren, they just come and see mom. You know, they feel very comfortable visiting her. If they, you know, weekly or whatever, maybe on a daily basis, people just call her so that, you know, is she all right? If she is, her lunch is provided by her daughter-in-law. So, you know, it's everyday contact. So they never feel isolated. And isolation, if you break isolation, that is, you know, in itself. I mean, even now, you know, for the Seva Day, a lot of organizations are saying, all right, let's go and visit the elderly. There's also a chaplaincy project which, you know, visits people when they're in hospital, because that's when they need this comfort, you know, that they are looked after. So all those elements are very, very important in ours. And the extended family is just not, you know, one person taking the caring role. It's the extended family who always pitch in at the time of need. So, you know, whenever mom's in hospital, somebody makes sure that her lunch and dinner is taken to the hospital, so that even if, you know, she hasn't had some food from the hospital, they'll make sure she feeds, you know, she's fed, or, you know, she has something that she likes. So, you know, all that is very, very important, and it helps recovery. Actually, you know, she doesn't need to spend 2-3 weeks in hospital. You know, she could be home in 3 or 4 days.
I mean, you are a very talented professional with a career and with children, and yet, in spite of all that, you've also sacrificed a lot of your time and your personal career to care for your mother-in-law. I mean, how do you feel about that? I mean, has that caused a problem for you? Or?
I think it is very, very difficult. I was an IT professional, and, you know, when you have long hours, I mean, the hours are not family friendly. There was a time when, you know, I could not do a professional job as a, you know, IT manager and actually do the caring role, so I had to give up one. Also, it's like, you know, with the extended family, the women in the family is the main carer normally, and they would, you know, forego time for themselves to make sure that others, you know, your own children may need support at certain times. So part of the ladies, you know, you have to be versatile, you have to adapt. You do take on the caring role in the family, no doubt about that. And I think right across the land, you know, the women keep the families together.